Hi, everyone. I am Liz Kafko. I'm a content manager with Beyond Type 2. And today we are being joined by Veronica Brady, who will talk to us about discussing complications around type 2 diabetes. So, Veronica, would you be able to introduce yourself to our BT2 family?
I'm Veronica Brady. I am a certified diabetes care and education specialist. I have worked in the area of diabetes for, let's just say, greater than 20 years. And I have worked with patients across or persons across the life spectrum. So it is my pleasure to be here with you today.
Thank you for joining us. I know complications around type 2 diabetes is, for a lot of people, a really scary topic to talk about. And so it's almost taboo to talk about sometimes. So I want to kind of just start off discussing them with people. So, what are some red flags that people with diabetes can look out for before developing complications with diabetes?
So we do know that complications usually occur as a result of having elevated blood sugars for a prolonged period of time.
Mm.
And some of the early complications that people might start to think about is if they're having, number one, vision issues. So if you're having some blurred vision or the spots or the floaters in your eyes or things are just not quite right visually, that could be a red flag that there are some problems brewing. As far as the feet are concerned, numbness or tingling or decreased sensation in the feet. So you're walking and your feet just feel like they're not quite there. The soles are not quite touching the ground. That could be an early red flag. And as we always talk about, sores that don't heal. So you get a sore on the bottom of your foot that just, you've been doing all the things that you know to do for it and it still hasn't healed. That also could present a red flag as far as complications are concerned. Some of the other complications that can occur are kidney problems, but you don't usually get a whole lot of signals with that.
Yeah.
Sometimes people may get, urinary tract infections, some burning or pain in the pee. Should certainly get that addressed. But true complications, as far as the kidneys are concerned, don't usually come with a lot of red flags. The other complication that we often talk to our clients or patients about are heart problems. So heart problems are also a complication associated with type 2 diabetes. So certainly all of us know chest pain is a red flag, but certainly, left-sided chest pain with jaw pain and things like that could be a red flag that there is something going on as far as the heart is concerned. So those are the primary four that I would think about as far as complications and red flags for those four.
Okay. And do we know if there's a certain timeline? Because I know a lot of people, they hear long term, and so they think, a couple months isn't a big deal, or the opposite, where my sugars have been high for 2 weeks. Am I going to, develop neuropathy from that?
So usually when we talk long term, we are talking elevations in your blood sugars 6 months to 2 years. Most people develop complications as a result of problems with their diabetes 2 to 5 years. So if your blood sugars are running high for 2 weeks, should you address them? Certainly. Are you at risk for complications such as, retinopathy or blindness and amputations? Not at all. So it's the things that go on long term. So if you've had high blood sugars for 6 months and you start to feel some numbness or tingling, or you're having some eye issues and those blood sugars are significantly elevated, you're in the 300s, you might want to get that looked into. Not might, you should really get that attended to. So 6 months plus, I think that people should address any of the warning signs.
Okay. That's really good to know, because I know that's the scariest part sometimes, is just not knowing how much time we have with these complications before they develop. So is it possible for people with diabetes to minimize complications? Or if they do start developing some of these complications, how do they heal from them?
So the biggest thing about minimizing complications, and I'm sure that people with diabetes have heard this 1,000 times, blood sugar. Getting those blood sugars within range is key. That is the biggest way to minimize complications.
Okay.
But say you begin to have some issues with blurred vision and blood sugars are elevated. I usually tell my patients that get your blood sugars down consistently below 200.
Mhm.
And 200 is kind of our catch point, because we know that when blood sugars are 240 or higher, that risk kind of increases. So consistently keeping those blood sugars below 200 can help to eliminate or alleviate issues as far as the vision. If they're having problems with numbness and tingling, and if people watch that, they'll notice that they get more numbness and tingling when the blood sugar levels are higher. Get the blood sugar levels down, you should see a decrease in that. So that's probably one of the biggest things to do to help to minimize those complications. We use our 3 pillars all the time. So it's diet, exercise, and taking medications as prescribed are the other ways to help to minimize complications. But it all really kind of hinges on what's going on with those blood sugars.
Okay. Yeah, that's, I think, important to know, in addition to just getting your regular, endocrinologist appointment, seeing your providers. If I ever feel anything kind of off, like, I message my doctor right away just to be safe and, err on the side of caution that way. So for someone who has maybe just found out that they're starting to develop complications, what lifestyle changes occur with that type of, news or diagnosis?
I want to, if you don't mind, I want to take a step back to a comment that
Yeah.
you made. And I think a lot of times in terms of self-management and things that you can do as the person living with diabetes, but you made a very valid statement about contacting your providers. So, and your provider may not always be, if you don't have an endocrinologist, because a lot of times we know that endocrinologists aren't as prolific, or there aren't as many as there used to be. So a lot of times it's your primary care provider, which could be your nurse practitioner or the PA, your diabetes care and education specialist. Any of those folks, I do recommend reaching out to and saying, hey, I'm feeling this. What do you think? So it's not to sit in your own space and say, I got to fix this for myself. So
Right.
you start to use that, your medical support. So then I forgot the question that you asked me.
That's
Sorry.
okay. So for a person with diabetes who has been told they're starting to develop complications, I think that can sound really scary because we don't know, what does that mean for my life, my day-to-day life. So what lifestyle changes occur when someone is told that they're developing complications?
So I think one of the first things when you're told that you're starting to develop complications, and I'll start with the eyes first. The only way to know if you're developing complications, other than you coming in and saying, oh my gosh, I'm having some problems with blurred vision and floaters, is to see the eye doctor. So when the eye doctor does that examination and says, oh my gosh, you've got the beginnings of some retinopathy, that is not automatically, oh, you're going to lose your vision. So if it is, we have different terms for retinopathy, the proliferative, I can't say the word, and non-proliferative. So if there is some beginnings of it that doesn't require, treatment with injections or something like that, again, it is going back to getting those blood sugars within an acceptable range. And that will help to alleviate or minimize some of these complications. As far as lifestyle changes, eye health, not a whole lot to do other than getting your eye exams. And sometimes you might need to see the eye doctor a little bit more frequently. As far as it relates to lower extremities, the numbness and tingling and beginnings of some problems there, the lifestyle modification in that realm would be certainly good foot care. And when you're exercising, wearing the appropriate footwear, and then also being mindful of kind of where you're placing your feet, and again focusing on those blood sugars. So the lifestyle modifications are, if you haven't already begun to monitor the blood sugars consistently and perform the exercise and be attentive to your personal care, your personal care. Those are the biggest things I can think of off the top of my head.
Okay. And do you know what's the difference? I've seen like shoes specifically for people with diabetes. How much better is that versus like your average Nike shoe? Is there a difference?
So the biggest thing when you talk about shoes for people with diabetes, we are talking about shoes with wide toe boxes. So it is I like to wear pumps. Pointy toe pumps are not ideal.
Me too. Yeah.
And usually for the men, the dress shoes that are more narrow at the top are not the best. But when you're talking about your athletic shoe, something that you can put on and your toes are not bound together. So having enough room in that toe box, because that's usually where a lot of that trauma comes in, is because you forced your foot into this small space and it's rubbing or creating calluses or some rubbing between the toes. So the Nike shoe, I mean, I have nothing against Nikes, but it's being sure that that shoe fits appropriately, that is not slipping on your sole and rubbing in the back, that your toes are not pinched and causing a lot of pressure on those toes. So this is my personal opinion. So again, this is Veronica Brady's personal opinion. I think that some of the things that are marketed as diabetic or for people with diabetes is not necessarily so, because I've seen the beautiful white socks. Well, you can purchase white socks and that don't have the real tight bands, and they don't have to be diabetic socks, because I think that's what they call them, diabetic socks, or diabetic shoes. So if you do not have foot deformities, standard shoes that fit well apply. For people with foot deformities, they are usually seeing a podiatrist and getting a specially made shoe.
Okay, that's good to know. So for someone who has been told that they are starting to develop complications or already have complications, what are the possibilities for them to heal or recover? Like, is that an option for people who have developed complications?
So it is possible to heal from some complications, and it depends on the extent of the complication. So the severity of it. So I tell people, if you're just starting to develop complications, that is you staying in contact with your provider to get the treatment that you need. So if you have developed, say you develop retinopathy that requires treatment with injections, that does not mean loss of vision. You can certainly recover from that, because the injections or the treatments are designed to stop that bleeding at the back of the eyes, which oftentimes allows that vision to return and correct itself. It depends on the degree of that complication. The same thing with neuropathy or that numbness and tingling. I usually tell my patients, if you've had numbness and tingling that has been persistent for more than 6 months, there are medications that can help to lessen it. The gabapentin, Neurontin, and things like that can help to lessen it, but it may not go away totally. So you adapt to that. So, you're not sticking your fingers in hot water and, testing temperatures with the tips of your fingers or your toes. You're using your elbows and things like that. So you may have to make some adjustments, but certainly you can minimize the progression. May not be able to change it, but you can certainly minimize the progression. And when we talk about, I don't know if I'm to talk about medications here, you can certainly delete this if you need to. But there are medications, the SGLT2 inhibitors, that have been shown to improve kidney function for people who've had some decline in kidney function related to diabetes. They've also shown to be heart protective in people who have had some issues with heart disease and diabetes. So there are certainly ways to kind of minimize those complications, if not have them cured or go into remission altogether.
Okay. That's, I think, really important for people to know, because they hear the word complications and they think their life is over because, they're going to lose their sight or they're going to have amputations. And that can sound really scary to them. For a person who maybe has been feeling these symptoms, these red flags that you talked about earlier, it I think it can be really hard for them to want to bring it up to their providers because out of fear that, they might discover something is wrong and they would just rather not know. So, how can someone with, these symptoms discuss these complications, these red flags with their healthcare provider? And, what should they take away from those conversations?
So the first thing I would say is I would hope that everyone who is seeing a provider has a level of comfort with their provider.
Yeah.
So that level of comfort meaning you can go in and say, there's something I really need to talk with you about today, or something that I've been experiencing. So with that level of comfort, we all have a kind of a fear and a hesitancy if to say something if we think we're going to get bad news.
Yeah.
Nobody wants bad news.
Yeah.
And so I respect that. But when you put that fear and that hesitancy aside and you go in to have that conversation, the first thing you should expect is to feel heard by your provider and supported.
Mhm.
And then the next thing that that provider should do for you is provide you with information to help you to process what these potential complications mean for you. So if you are a computer analyst and you're having some issues with your vision, your provider should be telling you your next step, you need to see an eye specialist. And I'll talk with you after that appointment and help to support you through that. So certainly you're maybe hesitant because you don't want bad news, but if you are feeling things and you've got some concerns, I would that you would be comfortable bringing them up with the person who is providing your care, because that's where you should get the support and guidance for next steps.
That's great. What feelings can someone expect to have when they have those conversations or when they leave that appointment?
So going into the appointment, that may be the fear. Coming out of that appointment, I would hope that they would have more feelings of, I wouldn't say relief, but feelings of, I guess maybe less fearful,
Hmm.
and knowing that there's a plan going forward.
Yeah.
Some of that, okay, I can manage this. I can do this. This is not a death knell. So it is something that can be dealt with. So I wouldn't call it relief, but certainly a decrease in anxiety and a decrease in fear of what these complications could possibly mean going forward.
Okay. And for someone who may leave that appointment still feeling very anxious and fearful, what are some tips to help them move past those feelings and towards taking care of, preventing this progression of complications? Do you have any?
So I think one of the first things that I would say is the diabetes community, in my opinion, is fairly close knit.
Mhm.
And so they may either personally know some other people who
Mhm.
have had these complications, or they may be able to find some support and some resources that involve people who've had these complications, and being able to talk with someone. Hey, I went to, my eye doctor and they told me this. Have you heard of this? And there are a number of resources online that talk about, you know, complications and potential complications and what should you do. So there are various places to find support, as far as helping to deal with some of the feelings that are associated with that, and some of the unknowns,
Okay.
some of the unknowns. So I think a good support system, family, friends, folks who have had these complications, or certainly with the health provider group. And I have to put in for my professional group, the Certified Diabetes Care and Education
Yeah.
Specialist. That is a great group of folks. If you have one, if you don't, you can always go to the CDCES website and find one. But there are folks that you can talk to help you to manage these feelings and as you continue to think about next steps. So support is key. And knowing that you're not in this and facing this, whatever the complication is, alone.
Couldn't agree more. I think my management has gotten so much better ever since I found a community that understands what I'm going through and understands the fears associated with living with diabetes.
Mm.
My last question is, what are some practical solutions for daily living with diabetes to help people prevent any progression of complications?
So you say a key word. It is living with diabetes.
Mm-hmm.
You know, and I often talk to people and I tell them I'm not the diabetes police, I'm not the food police. I think people need to live. And one of the things about living is that you incorporate the diagnosis or the disease into your everyday life. So it's the things you do from the time you wake up to the time you go to bed that makes for successful living. Part of that successful living is self-care. So I was just talking with a group earlier about the fact that I get 8 hours of sleep a night. It's just, that's who I am. And that's how I care for myself. So living with diabetes, you need to know how to care for yourself. You need to know what your needs are and you need to be able to vocalize them, knowing that you cannot be everything to everybody. Self-care, when you care for yourself, it helps you to be able to care for others. So incorporating the things that you know that you need. You know that you need exercise. You know that you need to eat healthy. And knowing that if you're on medications, you need to take your medications. So it's doing all of the things that you know that you need to do for yourself, but enjoying life along the way.
Yeah.
So not missing out on wonderful opportunities because I have diabetes. It's enjoying those things along the way, taking care of yourself, and being mindful of your own needs. So I'm one of those people, I think about mindfulness and meditation and things like that, which are excellent tools for self-care. And if you've got to take 5 minutes out of your day just to breathe and remember, I'm a person living with diabetes, but I'm a person first.
Yeah.
Taking care of your person.
Great. Well, this was all super helpful. Thank you so much, Veronica, for all your wisdom and sharing, what people with diabetes can do to take care of themselves. And I love everything you said. So thank you so much for joining us today. And for more resources about complications, check out our website at beyondtype2.org.